We are live now, ma'am.
Yes. Thank you, Sahiti. Good evening to all. I welcome you all for this Adolescent Menstrual Health CME, that is the Pinnacle News series number 2. Here we have news means the society I thought we will have from North, East, West, and South. That's the reason we have kept the name as news. So now we have the Kattika Society, Yavatmal Society, Kannanur Society, Nagarkoil, and Mao Society, and Darbhanga Society. So I welcome the President Ekika Singh, Dr. Meeta, Secretary, and Darbhanga President Dr. Kumudinija, Secretary Dr. Rashri, and the Kattigar President Dr. Lakshmi Sen, Dr. Secretary Dr. Shilpa Singh, and the Yavatmal Society President Dr. Charuta, and the Secretary Sushma, Kannanur Society President Dr. Geeta, and the Secretary Dr. Bhavya, and Nagarkol Society Dr. Sundar Narayanan, and Dr. Reshmi Ajit. And I thank Dr. Kamini Rao Madam and Cynthia Alexander Madam accepted to be the chief guest within the short duration, and Dr. Kumudini Madam and Lakshmi Sen for accepting as a guest of honor. And we have the wonderful speaker, Dr. Girish Mane, the past adolescent committee chair. He immediately accepted to give the talk on menstrual hygiene, and the secretary, Dr. Sushma, will be chairing the session. And we have the interesting panel with all the experts like Dr. Geeta Lakshmi and the panelist Mini Balakrishnan, Shilpa, Dr. Anjana, Dr. Mediani, Dr. Rashri, Dr. Supriya, and Dr. Akansha. Now, I welcome our MOC, Dr. Madhumita, to take over the session. We will start with the program. Dr. Madhumita.
Yes, ma'am. Thank you so much, ma'am. Can I go to ma'am's CV?
Madhumita is treasurer
Yes.
of Salem chapter.
Yes.
Yes,
Thank you so much. Yes, ma'am. So we would like to begin by introducing Professor Dr. Sampath Kumari, ma'am, who is the past Vice President of FOXY, and she's also the Senate member of Tamil Nadu Dr. MGR Medical University, National Corresponding Editor of JOGI, Founder Secretary of Tamil Nadu Federation of Obstetric and Gynecology, retired Deputy Director, Institute of Obstetric and Gynecology, Madras Medical College, Chennai. She's the President of Board of Studies of Obstetric and Gynecology at Tamil Nadu Dr. MGR Medical University. She was a past chairperson of FOXY Adolescent Health Committee, first ICOG Distinguished General Council Member Award in 2021 she has received. She's also the chairperson of Women's Wing of IMA South, and she's received IMA National President's Award and IMA Tamil Nadu State Branch Award in 2021. Thank you so much, ma'am, for bringing us this excellent webinar series, which unites all the parts of the country. So I would like to begin by with a prayer song. Next, moving on to the lighting of the lamp. I request Sampath ma'am to introduce our chief guests.
Thank you, Madam.
Yes.
It is our pleasure to introduce our Chief Guest, Dr. Sindhya Madam. She was the former Director, Institute of Obstetrics and Gynecology, Chennai, and the Superintendent of Government Hospital for Women and Children, Chennai, and the former Professor of Madras Medical College. And she has served in Tamil Nadu Medical Services for 35 years. And she was awarded with the Lifetime Achievement Award from Dr. MGR Medical University, Chennai, and from the DIPSI at Lucknow. And Times of India and Economics Times Award in New Delhi on 2018. Of all this, Madam is a well-wisher for everyone. I welcome you, Madam, and you give our blessings for the webinar.
Sure, thank you. I'm with you all.
Yes, Madam. Sindhya, Madam.
Yeah, so it's lovely to be here. And I thank the organizers for this opportunity of being a part of the Pinnacle News series. I feel, and I must thank the organizer personally, Dr. Sampath Kumari, because such a dynamic person, and I can never say no to her. So I am here today. We're feeling very proud. And as I always say, as an Indian, we have the pinnacle of the world, Mount Everest. So what a nice name for this new series. And as in adolescence, we always remember this line, as you sow, so shall you reap. And so as this series is being spoken of about menstrual hygiene and about heavy menstrual bleeding, we are actually putting a thing forward for the prevention of anemia, the prevention of diabetes later on in their life. So I wish this session all the best and God's abundant blessings and the message to reach the younger generation. Thank you, Sampath, for this opportunity.
Thank you, Madam. Thank you. Yeah, Madam. So nice of you. Yes, Madam. Thank you.
Yes.
Next, we'll go with the guest of honor, Dr. Kumudini Jha. She is the ex-HOD of DMCH and she is the president of Darbhanga Society and past clinical secretary of that society, and she has presented paper in national and international journals and faculty in FOXI conferences and presented many papers in several national conferences, and she was a speaker in CMEs and examiner in UG and PG exams. We welcome Dr. Kumudini Jha Madam, and Kumudini Jha Madam, we need your blessings. Your words.
Thank you so much, Sampath ma'am. It's such a pleasure to be and a privilege to be a guest of honor in your series, especially the new, and I congratulate you for this new series, Pinnacle. I'm really obliged to you. And whatever topic you've chosen, the first go, that is, it is very pertinent. What is menstrual health? Now, achieving menstrual health for all is essential for public health and gender equality. So we need to have a proper definition for it. And it is grounded in the WHO definition of health. And it implies that all those who menstruate have access to timely and age-related information. So sex education should be started in the schools. And they should have access to facilities and services which care for them, and especially during periods of dysmenorrhea, experience a respectful and positive attitude without any stigma. And they should be able to choose and participate in whichever sphere of life they want to join. It had started with using clothes, and then it went into napkins, and now we have the menstrual cup. So at least, and which is hygienic, and it is reusable. So it is cost effective also. So at least we should be sensitized first, be aware of it. Only then we can tell the school children, the college people, that how it is to be used and how it has to be cleaned. And this awareness amongst health providers is a must. So along with that, we educate the adolescents and for other things like menstrual problems, as you're going to tackle today, about heavy menstrual bleeding and the resultant anemia and its consequences. And of course, dysmenorrhea. If we can catch it early, endometriosis, their life can totally change. So we need to counsel the parents, the mother especially, that it is just an immaturity of the HPO axis, and it is because of annual ovulation that she's having that. And other factors like PCOS, of course, it is difficult to diagnose these, and we should not jump to the ultrasound. But in case we needed to rule out fibroids or anything, or endometriosis, then it is challenging because we cannot do TVS in these patients. So we'll be hearing about all this in the panel discussion from our learned speakers. And thank you so much, ma'am, for this opportunity.
Thank you, ma'am. Thank you so much. Now, Lakshmi Sen, madam. Sakiti, see you. Yes. So the Lakshmi Sen, madam, everyone I contacted Monday 10 days back. So all of them were so nice to accept it with a short duration. The Lakshmi Sen, madam, is the president of Katigar Obstetrics and OG Society. She is the senior consultant and member of IMA and FOXY. And now she is the current president of Katigar Society, Obstetrics and OG. Yes, Lakshmi Sen, madam, few words we need of this. Madam, you have to unmute. Sakiti, அவங்களுக்கு unmute பண்ணு.
Okay, ma'am, I'm trying.
Lakshmi, madam, that audio, there will be a small at the right end of the computer.
Lakshmi, ma'am.
Hello.
I guess ma'am is not able to hear us, ma'am.
Yes, she's not able to hear us.
Not able to hear us.
Hear us, I think some problem.
Admita message photo dan catla.
Yes, ma'am.
Shall we call her?
Yes,
Yes.
I'll call her. Sir. Ma'am is not picking, ma'am. She's not picking the call.
Yes, we will go with the scientific session.
Yes, ma'am.
Thank you, Cynthia ma'am, Kumudini ma'am, and Lakshmi ma'am. Now we will start with the scientific session.
Yes.
Dr. Madhumita.
Yes, ma'am. So moving on to our much awaited scientific sessions, we have two very important topics. One, a talk by our very renowned and well-known Dr. Girish Mane, and then we have a panel on adolescent heavy menstrual bleeding. I invite our chairpersons for the first talk, Dr. Sushma Tarak, who is the secretary of Yavatmal Obstetric and Gynecological Society, and Dr. Sundar Narayanan, who's president of Nagarkoil Obstetric and Gynecological Society, and also the chairperson of Endoscopic Committee of Tamil Nadu Federation of Obstetric and Gynecology. So I request you, sir, to introduce our first speaker, Girish Mane, sir.
I think both
Sir
of
is
them,
not-
they
yes,
told
sir.
that they will be traveling. I will introduce. Dr.
Yes, ma'am.
So Dr. Girish Mane, welcome, sir. He will be talking about the menstrual hygiene. If whenever we have a topic like menstrual hygiene, we think only Girish should give the topic. He is the director of Mane Hospital and vice president ISOPAP Vidarbha chapter, past president of Yavatmal Society, past chairperson of Adolescent Health Committee, and he got the best committee award and awarded best chairperson amongst in 2018 to 20, recipient of best society award, 2016 to 17, recipient of Durusha Youth Trophy, first winner of Foxy Talent Singing Contest, and contributed 12 chapters in Foxy Focus.
Thank you, Madam. Thank you.
Many papers. I think of all this, if you give a topic with adolescent only, he will come for talk. Other than that, he will not accept any talk. Anyway, Girish, welcome, Girish. You can.
Thank you very much. Good evening, ladies and gentlemen. I would say only ladies because there is no other gentleman except than me, at least on this platform. And first of all, thank you very much, Sampath Kumari Madam, not for this opportunity, but the opportunity in Foxy. Because let me tell everyone that whatever I am in the Foxy, probably Dr. Sampath Kumari Madam has a great role in my position or whatever I have achieved in the Foxy. Thank you very much, Madam. And actually, this CV is a little bit older. And under guidance of Dr. Sampath Kumari Madam, even we could achieve the best committee award in Foxy also, not only in the AMOX, but even the Foxy also. So I will share the screen. I hope my slides are visible.
Yes,
Yeah, is it
visible,
moving?
Girish. Yes,
Is it
visible.
moving?
Yes, you can proceed.
Yeah. So once again, good evening. And today I'm going to highlight a few points on menstrual hygiene in adolescents. Just a moment. Please. So as everybody knows that access to the safe, non-shameful and non-stressful and dignified menstruation, it is not only the need, but it is the right of every woman and every girl. And for this sake, there is one day which is called as Menstrual Hygiene Day. It is on May 28th always. Why 28th and why May? Because usually the cycle is supposed to be, normal cycle is supposed to be for 28 days. And usually the bleeding time is for 5 days, and that's why May. And every year the Menstrual Hygiene Day is celebrated everywhere. It is for the awareness of menstrual hygiene, because menstrual hygiene has concern with many things, not only in the adolescent age group, but even in the adult females also. Menstrual hygiene carries very important. It is directly concerned with the urinary system, reproductive system, and many other things. So, friend, probably menarche is one of the most important milestone in any woman's life. And it denotes or it signifies the start of reproductive capacity of that lady. But unfortunately, most of the females, or especially the girls, they are not having proper knowledge about the menstruation. They are not mentally prepared about the menstruation. Not their friends, but even the teachers or the parents, they are not giving the complete information regarding the menstruation, how the care should be taken, what are the difficulties in managing the menstruation. And that's why there are many problems created in our country, especially because we are developing country, and especially in the rural areas, the problems are very, there are tremendous problems are there. And because of the shyness and embarrassment, nobody wants to discuss about the menstruation. See, you can see in this picture, even in the bigger cities also, whenever we are talking about the menstruation, the girls, they are giving this kind of expression. This is the scenario in our country. Almost 100% of the girls, they never discuss about the menstruation before the menarche. Almost 87% girls, they are using the old clothes. They are not taking proper hygienic care. Then 86, they are not prepared for this. 86%, they are not prepared even for the menstruation. And 6%, they never heard even about the sanitary napkin also. So this is the current scenario regarding the menstruation, menstrual care, menstrual hygiene, the issues about the menstruation in India. Many times I feel surprised that males, they never feel shy to go on this pan patti or this daru ka dukan. They are asking about the tobacco, the cigarettes, and the drinkings. They are not getting any kind of shyness. But any girl, whenever she is going to the medical shop, they feel a little bit shyer. Even they are not feeling comfortable to talk about the menstruation or menstrual problem with their brother or with the father. And this should never happen, because this is the physical activity which is happening in every female's body, and it is very necessary to denote that you are very healthy. So this shyness should always go, and everybody should learn to talk they should have conversation regarding the menstruation and issues of the menstruation with everybody in the society. And probably the poor menstrual hygiene can be a hurdle to achieve these Millennium Development Goals like 2, 3, 5, and 8 also. And globally, almost 52% of the female population is there. And each of them, they are menstruating for 2 to 7 days normally, but there are lots of taboos still today in our country. And many adolescent girls, they are literally unaware about the menstruation. And the cultural practices and taboos around the menstruation, they impact negatively on the lives of the girls and the women. And while taking care of the menstruation, one should not forget about the mother nature. And while taking our personal care, we should even think of mother nature. And today we are going to highlight some points regarding the importance of what is the relation between the menstrual pads and the nature, we are going to discuss in short. And this lack of menstrual hygiene can make the girls susceptible for various morbidities. For example, the infection of the urinary tract, infection of the reproductive tract system, then long-term sequences, for example, the cervical cancer, infertility, ectopic pregnancy, etc. The girl can face because of the poor menstrual hygiene. There are certain taboos in our society. For example, many females, they don't attend the religious function. This, I am in my OPD, actually, almost every religion females, they are coming to the hospital and they are asking for the medicines to postpone the menstrual cycles. Then many girls, they are skipping the schools, they are skipping the tuition, they are skipping the sports, they are skipping their play. Then in many areas, it is said that one should not wash their body or hair while they are menstruating. Then they are sleeping separately. Many females, they are not even allowed to cook and never allowed to even go to the worshipping areas. Now, how the methods of menstrual hygiene management, they are chosen, actually depends upon in which culture you are there. Then what are the issues of that method on their health, then how much costly it is, I mean the financial or economical conditions of that family, then how it is used and how the care of that material is taken, and what are the methods of disposal. So these are the factors on which it depends that which method is used by that person. So there are many materials which are used for the menstrual hygiene. For example, there are menstrual clothes, there are reusable pads, there are menstrual panties, then there are commercial sanitary napkins, tampons, reusable tampons, menstrual cup, then various kind of biodegradable pads nowadays there are in market. For example, bamboo fiber pads or banana fiber pads or water hyacinth pads. Now coming to the menstrual cloth, this is the most ancient method of taking care of the menstruation, and it is till today it is used in many part of our country. These clothes, they are used, then they are washed and they are dried and sterilized in the sunlight, and they should be properly stored in the clean and dry place. Specifically in the rainy season, it is a little bit difficult to use these pads. There are certain advantages. For example, it is cost effective, it is very easily available, and it is eco-friendly. Means if it is dumped in the soil, then the biodegradation is very easy for this menstrual cloth, especially if they are made up of the cotton. But there are certain disadvantages, that is they can cause the abnormal vaginal discharge or skin irritation or many infections in the urogenital tract. Then coming to the reusable pad, they are made from variety of the natural as well as the synthetic material, but they can be reused after washing, and approximately for 1 year, definitely these pads can be used. There are certain advantages. For example, they have very little or less health impacts as compared to the regular menstrual pads. They can be used repeatedly, and that's why the annual cost is very less. Maybe they are paying little more at the time of this purchasing, but the annual cost, if you are calculating, then it is very lesser. But again, it can cause bacterial infection, bacterial vaginosis, skin irritation, and in the rural areas, availability can be an issue. The menstrual or period panties, usually they are used in the mentally challenged girls or females or very old females. For example, even though patients, they are postmenopausal, but if they are having some bleeding PV or something like that, then these panties can be used. Then coming to the commercial sanitary pads, which are used very rampantly, they are available, easily available everywhere. The cotton used in their making may not be 100% natural, and it can contain the pesticides, it can contain different kinds of gels or many other chemicals they are used. They are of different sizes, they are of different absorption capacity. Even they can contain the plastics, rayon, and cotton also. The advantages, the most important advantage is there is no significant adverse health effect, which is reported till today, because they are usually sterile. And then they are very skin compatible and they are user friendly. So these are the advantages of the commercial sanitary pads. So this is the picture showing the composition of sanitary pad, but there are lots of disadvantages with the sanitary pad. And nowadays we are not recommending sanitary napkins. I will come to this point later on. Everybody should know that they need to be disposed of after the maximum use of 8 hours. Number one. Number two, they are expensive if we compare with the reusable pad or other methods. Number three, they are not reusable, they are not eco-friendly, and majority of the pads, they are non-biodegradable and they contain lots of chemicals. Then one woman, she creates almost 150 kg of the non-biodegradable waste in a year. In our country, in a single month, more than 1 crore pads are used. This is a very huge number. Then one pad takes more than 100 years for its complete decomposition. It is not degraded very easily. It takes almost 100 years. Means, for example, if a pad is thrown on a ground, then that ground will be of no use for almost 100 years. Then our country produces more than 1,15,000 tons of menstrual waste in a year, which is a very huge. And there is no government strategy for its proper disposal. Then as the pads, they are deposited after one use, they create a large quantity of the liters and they can accumulate, they can get accumulated in the landfills. Even many humans, they are disposing in the sanitation. So that's why they can block the sanitation system. Then they can contaminate even the rivers also if they are thrown in the river. Then many times they are flushed in the toilets and they are clogging the whole system, sewage systems and everything. And the most important thing, if they are burned, then they can release the toxins, which are very injurious to health, which are carcinogenic in the nature. So these all are the disadvantages of regular sanitary napkins. Now coming to the tampons, it is nothing but the absorbent material, which is made from either rayon or from cotton, and it is inserted into the vagina. There is one long like thread like structure is there for removal of that thing. Nowadays, the sea sponge tampons are also available. The advantages is, for example, the sea sponge tampon, they are biodegradable, and they are, if any woman who is very used to for these tampons, the utility or the use of tampon is comparatively better than this pads, and the use comfort is more as compared to the other methods. But again, the disadvantages are there. First thing, for the virgin girls, it is literally very uncomfortable for her. Then they are expensive, and if not removed properly or on time, then they can cause the toxic shock syndrome, which is very fatal, which can be fatal for the user. Then they can cause the recurrent UTI, the recurrent vaginal infection. Then they are not accepted by most of the population of our country. Then they can even it can have the residual chemical or the fragrance, which can lead to the allergic reaction. And the most important thing, they are not very easily available. And again, same like the sanitary napkin, if they are thrown in these sanitation, then they can clog the pipes, they can disturb the whole system of these waters. So they can be there are again reusable tampons which can be washed. They are made up of the bamboo, the wool, or hemp, or cotton. The disadvantages and advantages are almost same. Now coming to the menstrual cups, which is the revolutionary material which is used in the menstrual hygiene nowadays. It is nothing but a non-absorbent bell-shaped device which is used or which is inserted into the vagina to collect the menstrual flow. It creates a seal and is held in the place by the walls of vagina, and it is made up of the medical grade of silicone. There are different kinds of sizes in that, small and larger one. It collects almost 3 times more blood than what a pad or a tampon can collect. Then it is usually emptied according to the flow of that lady. It is usually emptied after every 6 to 12 hours according to the need, and they can be rinsed with the clean water and they can be reinserted. I mean, for example, there is no issue of the disposal of this material after one use, isn't it? Then for its proper sterilization, the menstrual cup should be boiled in the water for 5 to 10 minutes. And there are 2 different shapes of or sizes of this menstrual cup, and the cost is very less. They are from 350 rupees to 2,500. They are very easily available online in the medical shops everywhere. And one cup can be reused for 5 to 10 years, depending upon its quality. If it is cheaper, then probably for 5 to 7 years it is usable. And if it is of very high grade quality, then it can be used even for 10 years. Now, there are very less disadvantage. Number one, the cultural barriers can be there because most of the females in the rural areas, they have not even heard about the menstrual cup. And when you are convincing these ladies to insert something in their vagina during their menstrual time, then it is very difficult to convince them, and it is not acceptable in our country. Then, especially in unmarried and virgin girls, it's very difficult to convince them for its use. But there is a very long list of the advantages of this menstrual cup. Number one, after some practice or after wearing for 2-3 cycles, It is the most easy method, and really it is a pleasurable method according to the history by many patients. Number one. Number two, it is easily available nowadays in the era of these smartphones. Everything is available everywhere. And the next important thing, it is reusable, and not for 1 or 2 years, but it can be used for 5 to 10 years. Probably this is the cheapest method of menstrual hygiene management if you are calculating everything. For example, the menstrual clothes, the panties, sanitary napkin, reusable pads, tampons. If you are calculating by any means, then this is the cheapest method of menstrual hygiene management. It works for a longer time, and that's why less frequency of changing. For example, a lady needs to change the sanitary napkin or pad after 8 hours, but this can be worn for even 12 hours, depending upon the flow of that lady. Then that curve can be used for 5 to 10 years, and that's why it produces almost negligible this menstrual waste as compared to the other methods. It is eco-friendly, and that's why it is not causing any injury to the environment. Then there are no expenses for the disposal, what we are getting in the for the disposal of the sanitary napkins, correct? Then there is no harm from any kind of toxins or fumes. Then there are very less health issues to the user. There is no damage to the sanitation or the drainage, no health issues to the sanitary workers, what they are getting out of that sanitary napkin. Then there is no feeling of shame for the disposal, because you are not supposed to dispose it so quickly, which is done every monthly when if any lady is using the sanitary napkins. Then the cups are often perceived as better than the pads of cloth in relation to ease of washing, drying, and storing, isn't it? Because the reusable pads or tampons or clothes, the washing and cleaning of those clothes and drying, which is especially little bit difficult. For example, in the bigger cities where the homes are very small, or in the village area where the houses are almost open, the female may get shy while drying, or putting those things for the sunlight drying. Then they are comfortable, they are leakage protected, then odor development is very lesser, then the quality and length of wear is little bit higher as compared to the other methods. So this is the menstrual cup. There are some air holes for the easy removal. Then there are capacity markings, and there is a small stem which is used, which is on the down part, which is, that is for the handling of that cup. These are the steps of menstrual cup use. Wash your hands with the soap. And most important, do not wash the menstrual cup with the soap. It should be boiled in the water for 5 to 10 minutes, isn't it? And one very important, suggestion to every woman whoever is wearing this or using this menstrual cup, that menstrual cup should never be tried while you are not menstruating. It should always be tried only when you are menstruating, because that will give some lubrication, which will definitely help for the easy insertion. So these are the methods, how they are used by, for example, the C-fold method, the 7-fold method, or any method you can adopt according to your, or according to the patient's comfort, she can use. It can be used in the squat position or one leg on the commode in the same position. So, and one very important message for the female who is using that menstrual cup, or who is going to use that menstrual cup, that menstrual cup will never cause any kind of pain while it's used, while it is inside the body. If the patient is complaining of some pain kind of thing, then 101% it is not because of the menstrual cup. There can be any other reason for the pain during the menstruation. This is how the menstrual cup is removed. Then it is boiled in the water, and there is no need to remove the cup while the patient is going for poo or pee. So it should be in place only. So there are two sizes, small and large, according to the need. They can use in the sexually active females. They can use the larger one, and if the female is not sexually active, then small cup can be used. Even if any female is like menstruating very lesser, then she can use a small cup, and if she is menstruating high quantity of the blood, then she can use the large cup. So 3 mantras for acceptance of the menstrual cup is: number 1 is mental preparedness, and unless and until your patient or yourself you are prepared to use this menstrual cup, it's very difficult for its compliance. Number 2, the one should have patience for at least 3 cycles. They shouldn't come to any conclusion within 1 or 2 cycles. They should at least use it for 3 cycles, then only they can decide whether it is the user friendly or not. And try only at the time of menstrual cycle, and without menses, it should never be tried. Otherwise, a person won't be satisfied with the menstrual cup. So the menstrual cup makes your period trash-free, rash-free, and cash-free, isn't it? So coming to the other methods of menstrual hygiene management, these are the pads which are made up of the biodegradable material. Definitely, they are having some advantages. For example, they are not only affordable, but they are nature friendly, and that's why they will cause very less injury to the nature, but they are not very easily available. Same are the advantages and disadvantages of this bamboo fiber pad as well as this water hyacinth pad. Yeah, so banana fiber, bamboo fiber, and water hyacinth pad. So they are almost same. I mean, they are made up of some biodegradable material and they can be disposed of very easily. If we summarize all the materials and if we take into consideration regarding the method of insertion, reusability, then the wearing time, then the need for a cycle, then price of one item or price for one complete year, then the health risk, the maintenance, then the learning cost, then the supportive material. For example, if any lady is using the reusable pads or menstrual clothes, then she will be definitely in need of the soap, the laundry detergents, the bucket, the storage bag, then the area for drying or for drying these clothes, etc. Isn't it? Then how the material is disposed of and whether it is eco-friendly. If we summarize everything, then probably the menstrual cup are the best for anybody else's. And if menstrual cups, for example, the girl is virgin or if she is not mentally prepared to use the menstrual cup, then the reusable pads or the menstrual clothes should always be preferred. And nowadays, the provision of, I mean, many NGOs, they are providing free of cost menstrual pads, but they should be like, they should even provide the proper methods of incineration also. For example, if they are providing the pad vending machine, then they should provide the incinerator to that school or to that I mean, wherever they are donating. And whoever is talking about the use of menstrual pads and they are teaching about the menstrual pad, then they should add some knowledge about the damage done by these menstrual pads to the nature and how those pads can be incinerated. For example, there are various methods of incinerator. Electrical incinerators are there, or clay incinerators are also there. So they should take this responsibility to for the proper disposal of these pads. Now coming to the facts of menstrual waste techniques. Appropriate disposal of the pad is still lacking in most of the part of the country. I mean, the people are throwing anywhere. Then most of the countries, they have developed the techniques to manage the fecal material, the urinary waste and everything, but there is no proper method or there are not strategies for the disposal of the menstrual waste. Then most of the women, they dispose their menstrual articles or pads in the domestic solid this waste. Many women, they are even throwing it in the toilets. The toilet facilities, they are not properly available in India. For example, I mean, the toilets in the schools or in the public areas, they are lacking the dustbins where these ladies, they are not, I mean, they are comfortable to dispose of their pads. They cannot change even their pads. They cannot hand their wash. And that's why these are the problems in our area. In urban area, the menstrual products are disposed by throwing in the solid waste management and sometimes in the toilets. But in the rural areas, they are having a lot of places, and that's why even they can bury them. They can even throw it in the pit latrines. And in the rural areas, most of the women, they are using the reusable methods, and that's why very less amount of this menstrual waste is created in the rural areas as compared to the I mean, bigger cities. In the school, many girls, they are lacking the school or they are skipping the school only because of lack of the sanitary facilities. For example, there are no, they cannot change their pads in the toilets. They cannot even dispose their used pads and all these things. And that's why our country should develop some, I mean, strategies for its disposal properly. The incinerator should be used in all places, or especially in the working areas or in the schools. They can be properly, I mean, there should be, or these institutions should be compelled to use, and there should be some person who should be given the responsibility to use these incinerators where all the garbage can be collected and they can be incinerated properly. So even government should create some laws regarding this. Government should even inform all the sanitary product manufacturer to print whatever chemicals they have used in those pads. It should be, the information should be open to everyone. and the menstrual hygiene management should be the integral part of the educational curriculum also. So I think we have discussed almost everything. So the recommendations from my side, menstrual cup should be encouraged for every woman, even for the girls and even the adolescent girls, they can use it. The reusable clothes pad should be promoted. Then most of the biodegradable products should be preferred as compared to the non-biodegradable these materials. Then there are not only this electrical incinerator, but clay incinerators are also there, which should be used for the disposal of this used menstrual pad, and better menstrual disposal techniques should be used. So these are the tips which we can give to the girls. Number one, change your pad frequently. Don't, take them for longer time. Then try to use the cotton sanitary pads if available. Then clean and reuse the pads very properly. Keep your vagina or vaginal area clean after the menstruation. Then use comfortable and clean undergarments and use the right and correct washing technique of the material. So these are the take-home message. Every medical person should know all these facts. For example, a pad is taking almost 100 years for its biodegradation. One lady is creating almost 150 kg of the menstrual waste in her life, and our country is producing almost 1,15,000 tons of this menstrual wastage in single year. So these all facts should be known to every medical person. Then we should educate the society about this knowledge, start using and encouraging the reusable pads or the menstrual cups yourself. Then avoid use of the non-biodegradable material. Use the incinerator if at all you are using this kind of this material for the hygiene management. The incinerator should be used, and this is a humble request from my side and from Foxy and from everybody. Thank you very much for the wonderful opportunity. If there is any question.
Girish, as usual, wonderful talk.
Thank you, madam.
If
Actually, I'm
any
not
doubts,
well.
you can-
I'm running out of cough now. So,
Are you not well, Girish?
yeah, actually, some cough is there, madam.
Okay,
But
thank you.
Sampath, the presentation was very nice. Very nice.
Yes.
Thank you, madam.
Thank you, Dr. Girish.
Thank
Okay.
you, madam.
These four adolescent talk.
Yeah.
Thank you.
And
Girish.
environment.
If any doubts in the chat box, Girish, please you answer it.
Yes, madam. Yeah, sure.
Whoever is having any clarifications, you can make in the
Sure.
chat box. Okay. Dr. Fatima has raised some question. Yes, you can ask. Reshma Fatima.
Madam, as such, there are no questions in this menstrual hygiene management and everything. The only thing we should go on revising and revising, so that the use of menstrual cup should be, it should not only risen amongst the doctor, but we should counsel our patient for the use of menstrual cup. Most of the doctors, they are not, counseling their patient positively. Even if the patient is not asking for the menstrual cup, we should ask them that what methods you are using, why don't you shift on menstrual cup? This is very, user friendly. This is causing very less injury to the nature. This should be from our side. So probably we should talk very oftenly regarding this subject.
Yes, definitely, we will do routinely. Thank you, Girish.
Thank you, madam. Thanks a lot.
Dr. Lakshmi Sen, madam, are you giving your wishes? Blessing? He is not able to open it. Anyway. Yes, Madhumika, we will
One
give
minute, one minute, 1 minute.
Thank you, Girish.
Welcome.
Thank you so much, sir, for such a vibrant session. Moving on to the second session, we have a panel discussion on adolescent heavy menstrual bleeding with moderator Dr. Sampath Kumari ma'am and expert Dr. Geeta Lakshmi ma'am. And we have our 7 esteemed panelists today with us. Can we move on? Dr. Sampath ma'am, Foxy past vice president, is the moderator. Dr. Geeta Lakshmi, who's the secretary of Oxy and member of Chennai Menopausal Society. Ma'am will be the expert for this session. We have our esteemed panelists. Next slide, please. Dr. Mary Ann, who's the past president of Nagarkoil Obstetric and Gynecological Society and president of Rotary Club of Nagarkoil and national coordinator of Safe Motherhood Committee. Next slide, please. Dr. Rajanna Jha, who is consultant gynecologist and former associate professor, founder secretary of Katihar Obstetric and Gynecological Society. Next, please. Dr. Mini Balakrishnan, consultant gynecologist and chairperson, KFOG State Adolescent Committee and state coordinator of Foxy Adolescent Committee. And Dr. Shipra Singh, secretary, Katihar Obstetric and Gynecological Society. Dr. Rashri Parve, who is the Secretary, Foxy, Darbhanga Obstetric Gynecological Society, and Clinical Secretary of ISOPARP of Darbhanga. Next slide, please. Dr. Supriya Narayan, who is the Specialist Medical Officer at PHC and also Senior Resident. And she's a Medical Officer at Sadar Hospital at Madhubani. Dr. Akansha Gupta, who is the Director of OMS Siddhant Hospital and Fertility Center and Cultural and Clinical Secretary of Foxy Mao Society. Yes.
All are there. I
Moving
know.
on to the panel.
Yes.
Yes.
I will. Yes. Madhuvik, all of them are there. Huh? I'm not sure. Hello.
Good
Hello.
evening. Good evening, Sambat. I am here.
You are here. Dr. Supriya is there. Dr. Akansha is there, I think. Dr. Ranjana.
Yes,
Dr.
ma'am. Ranjana ma'am is there.
Ranjana is there.
Yes, I am here. Yes, I am here.
Yes, madam. Dr. Mini Balakrishnan.
No, ma'am.
My video is there, Sambat.
No, your video is not there. Anyway. we
I
will
think
start.
they have to help me out to.
It's not.
Sahiti has to open.
Sakiti, open Geeta Lakshmi's video. Yes, we will start. Supriya, Akansha, Ranjana, and Dr. Mini is there.
Ma'am, I am also here.
Mary Annie has joined. Okay, thank you, Mary. And only 2 persons has not, I think so. Yes, now we will talk. I welcome you all. Geeta Lakshmi, your video open aicha?
I think you only have to say.
Actually, I have given access to ma'am, but
You have to open. Illana appadi answer.
ma'am,
So,
or else log out and join from faculty link, ma'am. Maybe you will get video access.
Faculty link I have sent you in the WhatsApp also.
Okay, ma. Okay, I'll do that.
Okay, ma'am.
Okay, we will
Thank
start with the session. Now we have the discussions on the adolescent heavy menstrual bleeding. Now we'll start with Dr. Supriya. Dr. Supriya, can you define the adolescent? How will you define the adolescent according to you or whatever the definition?
Ma'am, adolescent is actually, it is a transition period from the patient menarche to patient get its complete reproductive capacity. It is on an average from 9 to 16 year of age group. So these age groups come in adolescent age.
So according to WHO, how can you classify it?
Pardon, ma'am?
According to WHO, how will you classify the adolescents? Early, middle?
Ma'am, early adolescent 10 to 13 years of age group, and middle after 2 year after that 14 to 16, and late after 17 years.
Yes, Supriya. So during the early adolescence, there will be the growth of growth and spurt growth and the development of the secondary sexual characters. Middle adolescence is a period where then you are attracted by the opposite sex and they have the desire for experimentation. Late adolescence is they need identity and they have the well-formed opinion and ideas. So this is the normal menstrual cycle, as all of us will be knowing. This HPO axis, hypothalamus to pituitary, pituitary to ovary, from the ovary to endometrium, then the bleeding follicular and luteal phase. So the normal menstrual cycle being 21 to 34 days, and normally they use 3 to 6 pads. If it is increases more, we should consider that it has a heavy menstrual bleeding. Now we will go to the Dr. Akansha. You are there, no? How can you define puberty amenorrhea and what is the common cause? Dr. Akansha?
Yes, actually, ma'am, the definition of puberty amenorrhea is when the total menstrual blood loss is more than 80 ml in a menstrual period. Then we can then we can call it as a puberty amenorrhea. And the second definition, when if the adolescent girl, if she periods more than 7 days, then we also can call it as a puberty amenorrhea. And there are we can classify the causes of menorrhagia according to the palm coin classification. In the
Yes.
palm coin, the P is for the polyp, A for the adenomyosis, and L for the leiomyoma, M for the malignancy, and C stand for the coagulopathy, and O stand for the ovulated dysfunction, I for iatrogenic, and N for actually palm coin.
Idiopathic, non-classified.
COIE for endocrinal factor.
Yes.
Yes,
E
but in
for
but in adolescent girl, the most common causes are the bleeding and the anovulatory cycle. These are the most common cause that stand for the HMB, heavy menstrual bleeding.
Yes, Akansha. So as you told, the bleeding in 19 years is the puberty amenorrhea over 80 ml. Common is
Yes, ma'am.
anovulatory bleeding. Always when they attain the menarche, we have to wait for 2 years. That may be due to the immunity. After
Yes,
2 years
yes.
only, we are going to discuss that. So
Yes.
how, normally this is the mechanism of anovulatory bleeding. The unopposed estrogen, due to that there is dilatation of spiral arterioles, abnormal endometrial height, and spontaneous superficial filling of the endometrium that leads to the synchronous bleeding. So what happened? The continued estrogen elevation decreased effect because of the hyperplastic endometrium, then goes the HMB. So when a girl attains menarche for first 2 years, if they have some may have regular bleeding, some may not have bleeding, some may have monthly twice. This is mainly with the immaturity of the
Maturity of the HPO axis. Yeah.
So for first 2 years, we have to counsel that we have to see whether she is not going for anemia. So now we will go to Dr. Anjana. What are all the causes of heavy menstrual bleeding in adolescents? She was describing about the palm coin. Practically, what are all the causes of heavy menstrual bleeding in adolescents? Dr. Anjana, are you there? I saw her name. Anyway, Dr. Mary Annie, can you explain?
Ma'am, it is physiological. It can be physiological as well as pathological, ma'am. Physiological is anovulatory bleeding, and pathological is again anovulatory bleeding. The causes could be endocrinopathies, especially thyroid problems and increased levels of prolactin. And the common causes like stress and eating disorder, which is usually common in the young adolescents. That is the main thing is the polycystic ovarian disease. And again, it could be pregnancy complications too. Genital tract infections and coagulation disorders can contribute to a much extent to all these bleeding disorders, ma'am, especially in adolescents.
Yes, yes. So whenever when the girl has attained menarche means, as madam told, first you have to rule out the pregnancy and the other causes, thyroid, prolactin, yes. And finally, as Akansha was telling, this palm coin, polyp, structural causes and the non-structural causes. So what about the history you have to elicit? Whether Mini is there, Mini Balakrishnan?
Yes, ma'am.
What are all the history you will elicit in a case of a puberty amenorrhea girl coming to your OP?
First thing, even if she's unmarried, or we have to rule out a pregnancy, or even she is having a sexual relationship, we don't know. So first thing is we have to rule out the pregnancy. Then other endocrinological causes like thyroid or any history of any trauma. Then she taking any medications like any coagulation disorders like that. And then mainly we have to concentrate on even in newer polycystic ovarian diseases or other diseases like medical diseases like tuberculosis.
Yes. Any other drugs, whether she is a sports player, that and all the history we are going to elicit. Dr. Geeta Lakshmi, do you want to add anything as of now?
Yes, Sambat Kumari, your panelists, they have highlighted on the causes of heavy menstrual bleeding in adolescents. The thing is that when you have ruled out everything and when the obstetrician is suspecting, the gynecologist is suspecting a bleeding disorder, it is always better to go into the details of the medical history and to have a shared decision with the hematologist. So that is the most important thing when you suspect a coagulation disorder. That is what I would like to highlight, because any kind of medical disorder which is causing the bleeding, heavy menstrual bleeding in an adolescent, the management is going to differ. So that is why you have to be very cautious when you are going to rule out a coagulation disorder. So that is what I would like to highlight.
Thank you, Dr. Geeta. We were not able to see your beautiful face.
Okay.
So the history, as she was telling, we have to elicit about the age of menarche, menstrual pattern, and the number of pads she is using, whether it is associated with the pain or not. We should also put the leading questions to ask about the sexual activity and about the recent stress, whether if the girl is doing +2, means during the exams, university exams, they will be tensed and the stress, again there will be a bleeding, and weight change, whether loss of weight or whether there is increased weight, any chronic diseases, bleeding problems, any sports activity, any medications. So these are all the routine history we have to elicit. Now again we will come to Dr. Akansha. How are you going to classify the anemia? If the patient is going to have a heavy menstrual bleeding continuously, so how are you going to? Main thing is we are bothered about anemia. So how are you going to?
Actually, ma'am, in this, for puberty menorrhagia, we are going to classify anemia in 3 groups: mild, moderate, and severe. In mild, when the hemoglobin level is between 10 to 12 milligram per deciliter, and the moderate, when the hemoglobin HB level is more than 10, but it is below 12. Mild or moderate is more or less equal; both are same. But and in severe, when the hemoglobin level is less than 10, and according to the number of days, we also can classify in mild when the girl is having long menses, like if she is having a period of more than 7 days, 8 days, and she was a prolonged menses. And in moderate, if she is having if frequently short cycle, like if she bleeds for a few days and after 3 weeks she again bleeds, then we also classify like this.
Yes. So this is the way we are having basic as the 10 grams, whether it is above or in the 10 or below. Yes, Akansha, we are going to classify it according to that classification. So now, Supriya, how are you going to manage the girl with mild anemia? Now the girl comes with the hemoglobin you consider as 11. So the patient is she tells that I have bleeding for more than 6 days. So how are you going to manage? Dr. Supriya?
Yeah. Hello, ma'am.
Yes. How are you going to manage the mild anemia in adolescent girls?
Ma'am, at first, we will explain her the normal physiology and relax her. And we will explain her about the normal diet and how to observe whether her bleeding is normal or more than normal, or if the degree of anemia is going to hamper her daily routine or not, and how she has to catch over it, like with proper diet, proper medications. And if the bleeding is more than normal, then she has to take drugs like antifibrinolytic or OC pills, or if she is feeling anything abnormal, like
Supriya, 1
increased
minute. For mild anemia, do you want to start OC?
No need to COC. No need to COC.
Yes.
So mild 11 grams hemoglobin, I think there is no necessity as Akansha has mentioned. Okay.
Observation and dietary
Yes. So
suggestion,
how
ma'am.
will you counsel the diet?
Ma'am, to take iron-rich diet, easily digestible.
Yes, Supriya. So if the mild only bleeding is there means, you can advise the diet and you can start with the tranexamic acid. That is
Yes,
1 gram. Till the
and
bleeding is continued, it can be continued even for 5 days. There is no necessity for OC pills to be started in case of a mild. So if there is no improvement, now she is having a still bleeding, then if the bleeding is continuous means what will happen? The hemoglobin can come down. So in that cases, what will you do? If it is, then you can start with the iron tablet. That's all, 60 milligram of elemental iron. Always we should counsel the girls how to take the iron tablet. And these are all the iron-rich diet. As Supriya was telling, the iron-rich diet has to be counseled with increasingly with the vitamin B12 diet, folic acid, and vitamin C. These are all to enhance the absorption. So,
And
for
also, ma'am, if
Yes.
anemia, if she is getting more and more anemic, then to restrict her heavy activity during the menstrual period.
Adolescent girls, I don't think what a heavy activity they will be doing. What activity you will restrict, Supriya?
Like playing, cycling.
Oh no, that is
No,
not
these will
needed,
not
I think.
hamper her.
No, that will make her stress again. Let her continue the normal work. Yes, Geeta.
Yes. I think I'm.
Yes, we can see your face. Yes. Okay.
Thank you.
Okay,
Thank you.
Supriya, thank you. Then Dr. Mini is there, I think. How are you going to manage the moderate anemia? And for the mild, we have taken the diet, exercise, and if needed, iron tablet. So if she is the hemoglobin is 10 grams, little heavy bleeding, how are you going to manage? Dr. Mini, are you there?
Yes, madam. Yes, if bleeding is not controlling with the routine this thing and there is moderate anemia, we have to think of giving medications. So medications include combined. You can give either combined OC pills because it is actually there is a estrogen deficiency mainly, and the high dose estrogen containing pills will be better to have a hemostatic effect. And until the bleeding stops, we can give the tablet for either BD or TDS, and then we can continue as 1 OD for the rest of the month. And next month onwards, she can be having a daily 1 OD pill for 2 or 3 months till the bleeding stops.
How long will you continue, Dr. Mini?
Just like 1 month. And the next month, this month we'll continue for 1 month, 1 cycle enough. And then for 21 days, the rest of the month, rest of the 21 days dose is given. And finally, we'll give on progesterone.
Yes. So the progesterone, do you prefer to go with only progesterone tablet? Since
No.
we have a lot of side effects.
Usually it will be, there won't be adequate, the endometrium might not be that much estrogenized. So they're bleeding, there will be having irregular spotting with progesterone alone. So to have a correct hemostatic dose, we have to first have estrogen, then taper with progesterone. Then only there will be a normal estrogen progesterone ratio correction will be there.
Okay, now maybe.
Ma'am, I want to add something.
Yes, yes,
Can I add?
Yes,
actually, ma'am, if there is a history of any estrogen contraindication for that patient, then only we can prescribe only progesterone only pills. Like if the patient is having a history of migraine with aura, if a history of hypertension, prior DVT, if she is having any history of transplant or congenital cardiac disorder, then we have to switch over, prefer for progesterone only pills instead
But
of this
we can see
COC.
the endometrial thickness also, and depending on that, we
Yes.
can find out whether it is estrogen primed endometrium or whether it is progesterone thick endometrium. Depending on that, we can choose whether we want to use estrogen or progesterone.
Okay.
Most of the time it is nano-ovulatory. So you can go with the progesterone being the oral medroxyprogesterone and ethindrone acetate. As Dr. Mini is saying, if the endometrium is not sufficient, we have to go with the estrogen combination to see whether the patient will go for DVT like that. That has to be modified. So the cyclic progesterone. Yes, any one of you?
Dr. Sampath, nowadays people use micronized progesterone also.
Yes,
They can
yes.
start with 200 milligram of micronized progesterone in the same dose. And as Madam earlier, she told, as far as the heavy menstrual bleeding in adolescents is concerned, you start with the COC, that too monophasic combined oral contraceptive pill, which is the highlight. That is the thing that we have to add. Okay.
Yes. As Geeta Madam told, you can use the micronized progesterone, even the injections. Nowadays, sexually active adolescent girls, they can even have the progesterone releasing devices. Okay.
Ma'am, how can we give this, mother, what are the protocol for prescribing this micronized? What are the days and dose of this micronized NMP? Actually, we are not giving.
No, that we will do with the tapering doses. This
Okay.
micronized progesterone we have to give from 10th day to the 21st day for 2 weeks. That's all. Rajshri
Okay.
madam, welcome.
Actually,
madam.
micronized progesterone 200 milligram, you have to give daily for the first 12 days. So then when the bleeding is controlled, then you can switch over either to dihydrogesterone or any of the other options you can go. So that is the thing.
Thank you, ma'am. Thank you, ma'am. Thank you, ma'am.
Rajshri madam, do you want to tell anything? Dr. Rajshri?
Yes, ma'am.
Yes.
Progesterone is always given after the progesterone is given after the priming of the endometrium by the estrogen. It is given in the
Dr.
second
Nini
half
was
of the
talking.
cycle. It may be either given the norethestron or medroxyprogesterone for, and it is dose of this is depend upon the severity. Mainly it is given 5 to 10 milligram BD and norethestron, and other estrogen is given 10 milligram to 20 milligram 6 to 12 hourly medroxyprogesterone.
Yes, madam. So that is the way we stop the bleeding with the progesterone, and if needed, we can taper or we can go with the estrogen combination. Dr. Mary Annie, how are you going to control the severe bleeding? Now we have discussed the mild only with the lifestyle and diet, moderate with OT pills and progesterone. If the patient is having severe bleeding, that is hemoglobin is less than 7 grams, how are you going to treat the girls?
If
In
the
this
hemoglobin
case-
levels are so low and nothing could be managed with the conservative protocols, the next thing will be like we have to go for blood and blood products. Before that, we have to do a peripheral blood smear, serum ferritin levels also we have to see. And then if needed, maybe we need to look into the coagulation profile also. And then the ultimate decision will be on blood and blood products, ma'am.
That you can give with the hormones simultaneously. You are correcting the anemia, and you have to train the endometrium also, no?
Yes, ma'am. Together with the hormonal treatment, we are giving additional supplement with the blood and blood products, ma'am.
Yes. Rajshri madam, have you ever used the administration? Now the patient is not controlling with the oral estrogen. Then what will be your next
I
management?
like to give Primarine IV in 25 milligram 4 to 6 hourly until the bleeding stop if there is a no contraindication of the estrogen. And then we give the other things like a OC pills in the high dose, one tablet twice and thrice. And when the bleeding is totally stopped, then the dose of these pills is tapered down, and one tablet is given rest of the month. And simultaneously, we manage the patient with hemodynamically by the blood transfusion. If there is any coagulopathy, then we also prescribe the anticoagulant according to this.
If needed. So if the bleeding is severe means we go with the OC pills, and every 6 hours we have to give 1 tablet, control the bleeding, then continue as madam was telling. If it is not controlling with the OC pills, even after 24 hours means we go with 25 milligram IV conjugated estrogen. Now it is available, and once it is stopped, you can go with the oral. So for minor mild bleeding, you go with the counseling and the diet and the NSAID. Moderate, you go with the OC pills. With the severe, as Mary madam was telling and Rachi was telling, you go with the blood components, and then with the OC pills with the high dose. And if needed, you can go with the IV also. Dr. Geeta Lakshmi, do you want to tell anything?
Yes, as far as the severe bleeding is concerned, the hemodynamic stability of the patient has to be assessed by doing orthostatic blood pressure. You have to measure as well as the pulse, and accordingly you have to treat. And as the panelist rightly pointed out, that you go with the COC. But again, when there is a contraindication for using estrogen, then we can use progesterone only pills.
So progesterone high dose, stop the bleeding, taper, and then you can add with the
Yes.
So these are all the blood components. Nowadays, we don't use the danazol with the masculinizing side effect. Now we have a lot of generations, fourth generation
Yes.
also drospirenol combination. So now the bleeding disorder, as you have told, if it is not controlled, we have to rule out the bleeding disorder. And whatever it is the cause, we are going to treat platelet or whatever it is. So the assessment is, if the hemoglobin is less than 10 and irregular, which is not disturbing our work, reassurance, education, and PGA inhibitor is enough. If the hemoglobin is less than 10 and no active bleeding means, go with OC pills of 30 to 35 with the iron supplements. Progesterones are used in the anovulatory bleeding, MPA of 5 to 10 milligram. And if it is a patient is obese, and in that cases, you go with the drospirenol. And if the hemoglobin is 10, less than 10, and with the active bleeding means, you can go with the conjugated estrogen 25 milligram IV. So
Yes.
this is the way we are going to manage the puberty menorrhagia. So these is all the classification.
Ma'am,
Now, as a yes,
excuse
Dr.
me,
Supriya.
ma'am, high dose progesterone, if we can't use in heavy bleeding, adolescent heavy
Only
bleeding.
10 milligram BD or TDS. That's all. Not more than 30 milligram.
Not and
Not
because my
okay.
OC pills are very nauseating and many girls can't tolerate them.
Then we have to go with the IV, no? IV, we have to stop, but the only thing is we have to control the bleeding. This estrogen is not enough. Endometrium is very thin. So what to do? These girls, we have to tell them, take with whatever food you like, with that you take the tablet. So the ocipils is a one-day treatment. We have to give, otherwise she will go for severe anemia and anemia failure.
And in what dose, ma'am, DIMPA should be given? Injection?
The depot medroxyprogesterone is for completion only. Preferably, we can give only with the capsules we can add, but DMPA most of the times it is not advisable for adolescent. That too for heavy menstrual bleeding. The bleeding has to be controlled, no? Immediately it has to be controlled. For completion, I told that the LNG releasing copper T, the device and the DMPA. For heavy menstrual bleeding, DMPA cannot be used for an adolescent girl because the bleeding has to be stopped, and we are going to give progesterone only for 5 to 6 months. DMPA should be given once in 3 months.
Yeah.
Then she will be having only 2 doses. So the DMPA for completion I told, but that is not the treatment for adolescents.
Ideally speaking, we don't give DMPA for adolescents. So that is the take.
Now there are latest studies which tells that DMPA is not reducing the bone density. So for other cases, we can use, not for the heavy menstrual bleeding.
Heavy menstrual bleeding. Yes.
Dr. Supriya, now we'll go with that PCOS. That is the another sort of bleeding heavy menstrual. What is can you define PCOS?
Ma'am, PCOS is a very common condition among Indian adolescent and reproductive age women. It may be either one clinical and one biochemical criteria, like oligoovulation or anovulation, and clinical or biochemical sign of hyperandrogenism, and polycystic ovaries on ultrasonographic finding. Any two of the above.
Yes. Dr. Ranjana, are you there? Can you explain the pathophysiology of PCOS? Ranjana ma'am? Yes, Dr. Rashi ma'am, you can tell.
Mainly the pathology of PCOS is the hyperinsulin, obesity, hyperinsulinemia, hyperandrogenism, that or this disease start from the mother wombs, not from after the birth. It is also genetic and environmental. Nowadays, this is increasing due to the change of my environment and my food habit. That there's to help the increase the PCOS in my society, and so it is the mainly disease of start from the mother wombs and end at a endometrial cancer. So it start as a menstrual disorder, infertility, cardiovascular disease, hypertension, and diabetes mellitus, and last one is obesity, and endometrial carcinoma. So main pathology is that of this disease.
Normally, it is with the hyperinsulinism and the hyperandrogenism. As he told, if you are not going to identify it in the adolescent, it will go for a GDM during pregnancy and metabolic disorder in future with all NCD. So it is with the increased free testosterone level, which causes the disturbance, the anovulation and FSH-LH ratio is disturbed. Okay, so this is characterized by the, so for normally what we tell among these three, if any two is present, PCOS. But as far as adolescence is concerned, we are not bothered about the ultrasound, that morphology. So all the factors should be present. And we are not going to do the transvaginal examination. Only the ovulation and the bioclinical and biochemical features of androgenism. Yes, Dr. Mary Lily, can you tell, Dr. Mary Annie, can you tell about the clinical features of PCOS? Mary Annie, is there?
Ma'am, usually the girl presents with the first salient thing is increase in weight, that is obesity. Second thing is menstrual abnormalities. It could be irregular menstrual cycles. It could be heavy menstrual bleeding, or it is very scanty bleeding. They present with this, and then they come out with alopecia, hirsutism, and dark pigmentation, hyperpigmentation. And main thing is that and added to this, the girls will be found to be very fatty and very stressful. And of course, adolescent girls, we don't look into for infertility things, but these are the main things. And scan might reveal a polycystic ovary. Though it is not very significant, we see to all these added factors and clinch on that and treat them, ma'am.
Yes, Mary. So normally 90% of PCOS with adolescent is obesity. This features all of hyperandrogenism, menstrual abnormality, and ovulation, alopecia. Normally they will have the frontal lobe alopecia. Hirsutism. This is the scoring we are doing. Upper lip, lower lip, front, back, leg. So if the score is more than 8, we consider it as a hirsutism, and acne will be present. These are all with hyperinsulinism. Acanthosis nigricans, blackish colorations over the neck, and acrocordance is a skin tan that will be seen over the neck. These two indicates the hyperinsulinism. In that cases, we should rule out whether the parents have the diabetes, whether she is having diabetes. And the morphology is not concerned with the adolescent. We are not going to do the transvaginals. Always we use 10 follicles, 10 ml, and a volume of 10. So that is not with adolescent. And infertility, as Mary Annie told, this is not in future only. Infertility, GDM, and metabolic syndrome, not with the adolescent. Now we can, so these are all the causes to be ruled out normally. Dr. Mini, are you there?
Yes, ma'am.
Can you tell about the differential diagnosis? How are you going to rule out?
So you have to rule out all endocrinal causes like thyroid diseases. We have to investigate for prolactin disorders, then any congenital adrenal hyperplasia. Some of these may present with increased testosterone and other hormones. So androgen secreting tumors, we have to think about. Cushing's is another indication, another entity that we have to think about. And even sometimes there may not be any other problem, only isolated hirsutism. So it can be idiopathic hirsutism also. So all these endocrinological causes are often interlinked.
So this obesity will produce all causes. So we are going to rule out. What are the investigations are you going to do, Mini?
Yeah, we first thing is as we said, endocrine, like we have to rule out hyperprolactinemia, so do prolactin level. Then thyroid disorders, to do a TFT. Then 17-hydroxyprogesterone for insulin sensitivity, we have to think about the oral GCT. Then lipid profile, we have to think about. Then free testosterone and 17-hydroxyprogesterone will give a clue as to whether it is a other differential diagnosis also. Then ultrasound to rule out any other adrenal hyperplasia like that. Then dehydroepiandrosterone, FSH-LH ratio, all these for
only.
Madam, I asked, I have some question, ma'am. Actually, we are working in the very peripheral area. So they don't have so much money to spend for these investigations. So if we have a patient and if they are complaining of the infrequent cycle, a scanty cycle, then on the basis of the simple clinical history, I think in our area we are starting treatment on the basis of the PCOS management. We don't do all these
No,
investigations.
But we can do
this you
simple
can do.
investigation.
This
A
diabetes.
few like thyroid hai, serum prolactin
That,
hai.
Yeah,
These
yeah,
are the
that is
few in investigation. Most of
that
the
is
we have
enough.
even yes,
That is
ma'am.
enough. Thyroid, prolactin, and fasting and postprandial blood sugar. That's all.
Haan,
blood sugar.
blood sugar, yeah.
Hormones, if you don't do, no problem. If it is
Ji, ma'am.
hyperandrogenism, she will be having hirsutism.
Even actually,
So take care.
ma'am, we are not going with this ultrasound for adolescent girl.
No
We
need.
never go.
Yeah, first initial 2 years.
Until unless we didn't suspect for the mass or any like ovarian mass or any abnormality in the structural related, then
Yes, Akansha. As I told, only TSH, prolactin, and this GCT. This is
yeah.
enough. Other than that thing, if at all possible, you can do. Even if the pre-testosterone is increased, means what are we going to do? The hirsutism will be there. So we are going to start the treatment. So with the history only, whether she is having the bleeding irregularity, whether she is having the androgenic features, that is hirsutism,
Hyperandrogen.
having a blackish discoloration. If she is having blackish discoloration, then you can start the metformin. That only will be coming in the next cycle.
Yes, actually, Sampath, I want to add
Yes,
a point
Pooja.
that Dr. Akanksha, she's very practical and she is right in
Yes.
saying that how to diagnose a PCOS. So the diagnostic accuracy is very important to whenever you see a patient with PCOS or without a PCOS, as Dr. Sampath Kumari was mentioning, you have to go into the detailed history of the patient as well as the physical examination. That is very important. And the other thing is that the Rotterdam's criteria, actually it will overdiagnose PCOS.
Yes.
If you go according to that. And Akanksha, as you rightly said, the ultrasonogram is not mandatory for a
Yes,
PCOS,
ma'am.
adolescent PCOS. And if at all, if you're going to go for a ultrasound, it is better to go with doing a scan with, with the one ovary and the volume of the ovary and the number of follicles like that. But as such, for an adolescent PCOS, ultrasonogram is not mandatory. That I would like to.
The reason I have mentioned essential and this is desirable. Essential PSH, prolactin, GCT. That's all.
Yes.
So how are we going to manage it? The lifestyle management is the first management. Always 3 meals, 3 snacks, 30 minutes exercise. That is the treatment. Then if there is a menstrual irregularity, we are going to correct it. And if there is hirsutism, alopecia, acne, we are going to give the anti-androgen. And if there is insulin resistance, that is acanthosis and acropodan, metformin. So this is the way we are going to manage the PCOS. So if the bleeding is irregular, and how will you manage? That Supriya? The same thing as heavy menstrual bleeding. If the girl comes with history of 4 months amenorrhea and now she is having bleeding, this is very common with PCOS, no? In that case, we have to rule out the pregnancy. Supriya, are you there?
Yes, ma'am. Yes, ma'am.
So the PCOS with irregular menstruation, that is anovulatory. How are you going to manage?
Ma'am, at first, we will explain her that if she is having menses even at the interval of 90 days, then she should not worry so much. And if she is having heavy bleeding after a period of amenorrhea, then we will go first for urine pregnancy test. And if he's so much concerned for irregularities of the menses, then we will go for OC pills. Actually, we will offer her low dose OC pills, ma'am.
Yes, first you stop the bleeding with progesterone. That is
Yes.
then.
Or ma'am, we can say to her that PCOS is a very resistive type of disease, or we can say, but we cannot treat 100% it. So we have to explain that if she is getting 6 or 7 cycle in a year, that is enough.
That
is she be
So now if it is a heavy bleeding only, we are going to start this type of treatment. Otherwise, if the bleeding is regular and it is normal, means no need for treatment, only lifestyle.
Only counseling will be.
Yes.
So if at all, if you're going to give OC pills, so how long you're going to give?
Right? If now some girls are taking even for 2 years. If they stop the vocipils, they are not having the bleeding. So some girls, they are taking even the 2 years also. But once PCOS means completely we cannot stop it. It will come and go. The main thing is lifestyle changes is the must. It has to be followed.
But that, Sampath, that is the word that our patients don't like. When we say lifestyle modification, they say, what doctor, you're going on telling lifestyle modification, lifestyle modification. So
No,
they
but-
want some kind of a treatment, but they don't understand that even 5 kg less of their weight is going to matter in the next cycle. So that is why, that is what we have to explain to the patient.
Yes. Normally, I
That's a-
used to tell that diet is not only for adolescents. The whole family should take the same type of diet. So if we are giving only fruits and vegetables to the adolescent girl and the mother is taking chicken and mutton, she will get irritated. So
Yes.
the whole family should cooperate.
Actually,
Yes.
ma'am, in today's era, everyone wants to look slim and trim and good
Yes.
looking. So when we explain her for regular exercise and diet, I think there is not much resistance, and everyone is familiar with YouTube, Google. So they are concerned with our advice and they follow it easily.
Yes.
But you cannot tell that don't take pani puri, don't take pizza, burger. You take it once. Like
Ma'am,
that,
they,
tell
they
will
can take
listen.
it decreased amount.
Yes.
Whatever they are
Respected-
taking, they should take in decreased amount.
Yes. So if the girl is having hirsutism and alopecia, so what is your type of management, Dr. Supriya?
Ma'am, if she is having hirsutism, then we will advise for her hair removal techniques like waxing, laser, or there are electrolysis. And there are many OC pills with anti-androgen activities. We will offer her, and in case of alopecia, anti-androgens are given.
So cyproterone acetate 2 milligram and ethanol is 35. If anti-androgenic feature is needed, this is the way of treatment. So Rashri madam, when are you going to start her for metformin?
When you find that we do the PCOD profile, or we find there is increase high insulin and
Nowadays,
level,
we don't do
fasting insulin
insulin.
level is high, and also we find there is a level of the testosterone is high. So metformin acts to what? One, desensitize the insulin, and second, it increase the sex binding globulin that is formed from the liver. So metformin acts two-way work, and we like to give and this dose is not less than 1 gram to 1.5 gram per day, either divided dose or in the 1 gram, we give the single dose at the night.
Okay, madam. So if there is
But
an
Dr. Sampath Kumari, practically speaking, we don't do all these tests and start
insulin we are
metformin.
not doing, but if
We are not doing.
any discoloration, blackish discoloration is present.
Whenever you
value
see
is
the
increased.
features of
Hyperandrogenism.
Hyperandrogenism, you go with anti-androgen. Only with
When
the
the-
insulin resistance, you go with the
Obesity and deranged blood glucose level.
yes, blood glucose. So the
And
normally
of course,
don't do
when the
that.
BMI is also more than 25, that also
BMI,
is.
Metformin can also be used for obesity. Actually, madam, nowadays we don't go with the fasting insulin. So what are all the other drugs you prefer? So if there is a bleeding irregularity, go with ocipil. Androgenic features, go with anti-androgen. Insulin features, you go with metformin. So if androgen is hirsutism is also present, bleeding irregular means you can combine with ocipil. So
We
what are
also give the vitamin D. For
vitamin D is
PCOD.
that is very useful.
How
And
many of
also
you
in
are
somewhere the folic acid is also somewhat helpful, either the prevention of the anemia with the iron, and
Yes.
also in the some way of the PCOD also.
So if some girls, if they are not able to control their weight reduction, means you can go with anti-obesity drugs like sibutramine. Because some girls we continuously will tell you they are not able to reduce, means this can be given. And there are studies which tell that the inositol, myoinositol,
Is also
but
given.
still there are evidence is needed but there is no side effect for this. You can use it. As Madam was telling, we can go with the vitamin D and other combinations. This surgery, laparoscopic drilling and bariatric surgery, we never advise for an adolescent girl unless nothing is working out only, we go with. So this is the PCOS, always lifestyle modification is the treatment, OC pills, anti-androgens, and insulin resistance. So
And we also need to tell them, we need to give them counseling also. It's not like giving advice or like that. We need to just tell them in a friendly way that it has to be accepted, and it is the girls who have to cooperate with all these things. So even the patients, I mean, the girl's mother will switch on to from one doctor to another doctor, seeing that this doctor doesn't give good medicine. So 3 months the girl was on medicine, and again she gets again irregular. So the psychological counseling is the vital thing which I feel. And then we have to make a relationship to the patient in such a way that they are more confident with us than their own mothers, friends, and teachers, ma'am.
Yes, one advice for adolescents. We will start with Dr. Rajshri. Rajshri, madam, what is the advice for adolescents?
What is?
Not advice,
Again,
information. For adolescent girls.
We always advise the adolescent girls to something learn from her mothers and her teachers and nearby family member who give the idea about the menarche, any dysmenorrhea, or there is a early detection of the endometriosis that is also increases in early ages, and also the menstrual hygiene that is also given that the very good answer, and also advise the sexual health. Nowadays this is increases, so I also advise about the sexual health and take the and diet.
What is your advice for adolescent? Dr. Akanksha?
Yes, ma'am. I will advise her. मतलब कि जैसे most of the adolescent when they are coming in our OPD and they are very anxious, and because they doesn't know कि the in मतलब initial few years are annulatory, and their mother also they also don't know कि that is a मतलब normal cycle. These are the physiological, not pathological. First of all, we have to also counsel their parents also. So that they can advise their daughter or their family members.
Dr. Supriya, what's your advice? Dr. Supriya?
Yes, ma'am. I will advise her to eat healthy and think better.
Okay, nice.
समय के साथ सब कुछ ठीक हो जाएगा. Don't be panic and don't involve in unprotected sexual.
No stress.
Don't be afraid. Yeah.
Dr. Mini?
Yes, madam. I will tell them get along with the PCOD because it's not worry you. You should not be bothered about it.
Not only
move along
PCOD,
with that and get,
advice.
yeah, it should not interfere them. Actually, they should be bold to continue the treatment, and it will be there. Don't worry about it. Let it be there.
All.
You carry on.
Dr. Mary?
The same what I said earlier, ma'am. So it is how we convince the problem to the patient as well as the family members, especially the mother and the father. And the trust should be in such a way that patient should believe what we are talking, and even advice on food and other things, everything should be, I usually say, discipline in everything, not only in character. It is your food habits, it is your lifestyle habits, and everything, the amount you sleep, the amount you eat, the amount you do some exercise or some relaxation in some activities. This is what I convey to my patients, ma'am.
Thank you. Dr. Geeta, final advice.
Yeah, Sampath, see, we have done many school programs and all, and we have met a lot of adolescent girls. Some people have attained menstruation, some have not. And you see all the girls, they are very inquisitive and they come and ask us a lot of questions. But when it comes to a problem like puberty, menorrhagia, and that, the mother only should be reassured, because she is the person who is going to be very much worried about it. And we have to treat the girls accordingly. But as far as the polycystic ovarian syndrome is concerned, I would always say lifestyle management modification, because a decrease in 5 kg is also going to matter. Not that using a long time
COC or hormonal contraception on these kind of girls, it is better that we focus on the lifestyle modification. That is the thing. Not only diet, but we have to focus on the exercise, yoga, meditation, and we have to tell them about the future problems that they are going to face. Not that we are going to scare them, but it is better that we highlight about the future problems such that the girls at the young age itself, they can take it up and definitely they'll find a cure. So that is my advice to the adolescents.
Thank you, Dr.
Okay, thank you.
Had a
Thank
wonderful
you, ma'am. Thank you for the wonderful opportunity. Thank you, ma'am.
Thank you, Sambat, for the opportunity.
Thank you all.
Very nice moderation and very nice panelist also you had. Very nice. Thank you, Sambat. Thank you.
Thank you, Dr. Madhumita.
Yes, ma'am.
Okay,
And I think
Madhu,
we're finished.
thank you so much.
sharply.
Nice
Thank
to
you.
see you after some time.
Yes, ma'am.
Okay.
Yes, sir.
Bye,
And
Madhu.
we have rightly finished. Correctly, we are on time, ma'am. Exactly. We have just finished.
Bye,
Really nice.
Madhu. Thank you.
Bye, ma'am. Bye, ma'am.
Thank you,
so
madam.
much.
Thank you.
Thank you.
Thank you. Thank you so much.
President and Secretary of Kartigar Society, Yavatmal Society, Kannur, Nagarkoil Society, Mao Society, Darbhanga, and Dr. Girish Mane for the wonderful talk, and the chief guest, Dr. Kamini Madam and Cynthia Madam, and guest of honor, Dr. Kumidini Madam and Dr. Lakshmi Ma'am, and the panelists, wonderful panelists, Dr. Ranjana, Dr. Mary Annie, Dr. Mini Balakrishnan, Dr. Rajshri, Dr. Supriya, and Dr. Akancha. I thank everyone and expert Dr. Geeta Lakshmi and Dr. Madhumita.
Thank you so much, ma'am.
Thank you so much, ma'am.
We will be having the program every month, Thursday. Second week, we have the obstetric topic. Fourth week, Thursday, we have the gynec topic. This is the Pinnacle News Series. Thank you.
Very nice.
All
Thank
the
you so
best.
much, ma'am. Good night, everyone. Thank you so much.
Thank you.
Agiti and Cynthia. Thank you all. Yes.